Hello and welcome to Within the Frame. I'm Han Da-eun in Seoul. Coronavirus cases are surging again across Korea just about a year after the country officially declared COVID-19 an endemic. Amid signs of a large spread, the Korea Disease Control and Prevention Agency has boosted response measures, also gearing up to resume vaccination programs. Self-diagnosis kits are flying off the shelves, while COVID-related prescriptions soared by more than 30-fold in recent weeks. And the summer COVID wave is being felt globally, hitting over 80 countries around the world. Why are we seeing a resurgence in COVID-19 cases, and how stringent should quarantine measures be this time? When might we expect the peak of the outbreak? For some expert insights, Dr. Seung-taek, virologist at Institut Pasteur Korea, joins us in the studio. Thank you so much for coming in today.
Thank you for having me.
And joining us virtually is Dr. Peter Chin-hong, professor of medicine and infectious disease specialist at University of California, San Francisco. It's great to have you with us.
Thanks for having me on, Da-eun.
All right, Dr. Kim, let's start with you. So COVID-19 is back on the rise here in Korea. First, give us an update on the current situation.
Well, we just heard about more than 1,300 just hospitalization as of second week of August, and this is about just a 9-fold increase over the last month. And then, although we are not actually just counting all the cases of infection right now, but based on the number of this hospitalization, we are actually estimating about just 170,000 cases of infection right now. And then the half of the hospitalization infection are thought to be at this moment is due to the KP.3 infection, which is actually just the Omicron subvariant. And then at the same time, we are actually just witnessing the some surge of the virus, the viral genome copy number in the wastewater system, which is actually just an indirect just a measure of the circulating just pathogen, including the viruses right now. And then the thing actually we are experiencing right now is a little bit of a shortage in the some diagnostic kits and then the antiviral drugs. And I think just Korean health authorities are actually just addressing these issues right now.
And it seems similar stories are being played out elsewhere in the world as we are in the middle of a global summer COVID wave. Dr. Chin-hong, is the U.S. also seeing a large summer COVID wave? And what do the latest figures indicate?
So just like in Korea, we are seeing an increase in all of the metrics. Wastewater epidemiology is up, test positivity is up, emergency department visits, hospitalizations, and deaths have remained relatively stable or low. We've seen it in the West since May or so, but the rest of the country has caught up, and it's thought to be due to many factors. Whether or not heat waves, wildfires in the West might have spurred it, as well as people going back to gathering together with vacations and so on.
Now, most respiratory diseases circulate typically during the winter. Dr. Kim, what are the factors that led to a summer COVID wave that we're seeing around many parts of the world?
Well, as you told, many of the some respiratory viruses, including the influenza virus, actually the typical season is actually winter. And then even by just some experiment, as the prior investigation actually demonstrate that the influenza virus is very well transmitted in the cold and then dry weather, which is actually just a winter. But this COVID-19, I mean, in this case, SARS-CoV-2, it is just a causative agent of COVID-19. So far, it seems to be some exceptional. And even in the peak of the COVID-19 pandemic, we have actually witnessed many cases of just infection, even in just the tropical areas. And then, so we do not understand for sure why this virus is actually even just rampant in this very warm and wet weathers. And then so far the people are thinking about some many indoor activities due to the steamy hot weather might just contribute to the some surge of the COVID-19. That might be true. It's like also in the winter season, many people actually just many activities are actually occurring the indoor settings. But we do not know for sure why this COVID-19 is also has a peak even in the summer season. Well, so far we have witnessed like some very similar patterns, and the summer season and the winter season we have just two peaks around the world, and then there might be some relevant, there might be some maybe some related to the some population immunity issues, but we are not actually understanding just completely about the issues, and then we will see it, and then probably for the time being we might just see the these two peaks for the annually, but this might just change, and it might just even just change into like the flu season, but we do not know for sure at this moment.
So many people taking respite from the sun indoors could be one major factor that led to the summer COVID wave, but further review needs to be done, even for medical experts, to find out exactly why we're seeing a summer COVID wave and if the pattern will continue in the coming years. Exactly. Dr. Chin Hong, Omicron subvariants were the dominant strains before we bid farewell to the pandemic last year. What type of new variant is driving the summer wave of infections? Dr. Kim just briefly mentioned about KP.3, but could you tell us more in detail about that, and what do we need to know about it?
So what's driving a lot of the increase in cases seen globally is a new crop of variants. They're all descendants of JN1, which was predominant in the winter, and they're called in general the flirt variants. Right now, KP.3 and KP.3.1.1 are really circulating at high levels, and it's thought to really jumpstart the cases that we're seeing right now. They account for more than 50% of the cases in the United States right now, particularly in the West Coast. So variants are definitely contributing to what we're seeing right now.
Do we know if the KP.3, the new variant, is causing more severe symptoms, or whether it's more contagious? Or do we know anything so far about those fronts?
Yes, we know that KP.3, KP.3.1.1, and that family, they're likely more transmissible by about 20%. They're likely a little bit more immune invasive. That means the immune system doesn't recognize it quite immediately like some of the others. And we also know that it probably doesn't cause more serious disease. However, if you have a lot of people getting infected, even a small proportion of those people will include vulnerable individuals who can get hospitalized, and even some of them may die.
Now, I've come across some articles that the U.S., there is definitely an upswing in the number of COVID cases, but there's much less hospitalization compared to last year. What do you say to this?
Yes, that's true. What's happening over time, regardless of what variant we're seeing, is that the population immunity is improving with every successive wave of infection. And that's what you're seeing in the United States. It doesn't mean that people aren't being hospitalized. It doesn't mean that people aren't dying, but the numbers are much smaller than previous. Even though we have the same levels of virus circulating by wastewater like in summer of 2022, but it's still lower than the winter seasons that we've had in years past, and the hospitalizations are much lower than in previous years.
Dr. Kim, Korean health authorities plan to resume free COVID-19 immunizations for the elderly and for the other high-risk groups as well. While some are calling for an early start to the program amid the rapid surge, what's your take?
Well, I think just vaccination in October is actually just preparing for the winter season. I mean, that's some health authorities actually just predicted, and that those times actually coincide with the flu shot. Actually, the flu shot, but I think they probably have to think about some contract issues and import issues, because now all the vaccines are somehow mostly just imported from the abroad. So there might be some technical issues, things that. And then regardless of this, maybe earlier just vaccination, of course, might just help just to prevent the further infection and then the progression to the severe diseases. That's for sure. And then at this moment, moment, well, as I told you earlier, maybe diagnostics, and the antiviral drugs are very important because somehow, as Dr. Chin-Hong said, now most of people are not really just naive in terms of immunology because most people are somehow exposed, experienced this virus, whether it was vaccination or just a prior infection. So we are not actually immunologically naive anymore. So most of people actually do not actually go to the some severe state of the infections. So if we want to just prevent progression to the severe disease, especially for people with some high risk groups, that we need some antiviral drug treatment as soon as possible. Well, as probably for the Paxlovid within 3 or 5 days of a symptom onset, and then for remdesivir and other just the Lagevrio, things like that.
There's a time lag between COVID-19 vaccines and the circulating virus, with the circulating virus, of course, being always one step ahead. The October vaccination program will offer updated shots, but they target JN.1, the predecessor of KP.3. So will the shots be effective against the now dominant KP.3?
Well, this is not really just the first case. When we actually start some updated vaccination, which was actually just, the vaccination against the Omicron, even that time we are actually delayed. And then this is sort of just inevitable because whenever we actually just detected some new variant, and then we actually started to develop the updated vaccine. But the time in the time that we got some approved by the some authorities, then maybe just a new variant is just emerging. So it's kind of inevitable. But the good thing is that the lessons that we have learned so far, even for the some COVID-19, is that even for the some ancestral vaccine that we actually just received in the earlier just COVID-19 pandemic are still just effective. And then for this, even for this KP.3 and then JN.1, I don't think I still just believe that this vaccine will be very effective. And then this virus is, well, compared to this ancestral virus, is in terms of genetic, the sequences, is very similar to the currently circulating virus, and it's still just very effective in terms of the neutralizing antibody. Well, actually, there are two different arms of when we actually got vaccinated. One is antibody response, and the other is a cellular immune response. And then we will have some good antibody response at least. But that antibody response actually does not last for a long time. It's like after 3 or 4 months after the vaccination, it just wanes. But we still will have the very strong T cell immunity, which is known to last much longer period, and which will be very good for protecting the people, especially in the belonging to the high-risk groups.
So even if most of us are now somewhat reluctant to get vaccinated, you still recommend people, especially those in the high-risk groups, to go get the shots because they will be effective. And they are necessary to ward off the virus.
Exactly, and because the people belonging to the high-risk groups they are very vulnerable. So even infection may just predispose those people to the progressing to severe disease. So at this moment, protecting those people are number one, a priority at this moment, whether it was vaccination or treat with the antiviral drugs.
Dr. Chin-Hong, the U.S. National Institutes of Health has launched long COVID clinical trials through what's called a RECOVER initiative to research causes and treatments for people with long COVID. What are the symptoms of long COVID, and what has the RECOVER program discovered so far?
So the RECOVER program was about $1 billion effort, started about 3 years ago by the NIH in the United States, as you said. Long COVID is a constellation of about 300 or so different symptoms that people may have, including brain fog, shortness of breath, cough, muscle pains, mental illness. So it's very broad ranging, and it can occur 3 or 4 months after the diagnosis of COVID. What has the RECOVER project achieved so far? Probably not enough yet, as many people have seen, but many studies are ongoing. Most of the studies have been observational, meaning that They have not been clinical trials. They've not really been any great trials of a therapeutic option that might work against these symptoms that affect so many people. But the infrastructure created by the Recover program has led to some negative studies, like knowing that Paxlovid probably doesn't work. Some observational studies showing that vaccines probably decrease the risk of long COVID by about 70%, and some understanding of the pathogenesis, like bits of virus can remain as long as 16 months after infection, leading to potential treatments in the future. At the end of the day, it's challenging because long COVID is probably a group of diseases rather than one disease, so it's tough to study. But nevertheless, some people think we need more money to really understand it more comprehensively.
Looks like we have many more questions than answers about long COVID as well. Dr. Kim, Korean health authorities say cases will likely peak by the end of this month, coinciding with the start of the second school semester. Health authorities project cases to reach over 350,000 per week. What's your outlook ahead?
Well, I agree with their just projections, and then their sort of just stance at this moment is that's very just a reasonable response, and then they actually do not change any public any measures at this moment, and then because we have experienced the COVID-19 now for like 4 years and then 5 years, and then we know pretty much about this virus and then disease itself, and then the good thing. But the thing that I just concerned about is we are actually going to just witness the surge of the COVID-19. But then the issue is how we can just protect some vulnerable people. And then in this case, we have to actually remind ourselves that the public measures, the measures we have actually taken in the early just COVID-19, just wash hands and then just wearing just masks and then things like that. That's actually just very important. But the thing actually changed. Now there's some category, just a disease category actually just changes. So the many just public measures actually just changes. So where in the early COVID-19, if we just got COVID, then we can actually just legally just allowed for just having just leaves. But now there's any just official leaves are not just allowed at this moment. So, but I think in the anyway, the very just the thing actually we have to pursue is that once we got just impacted by any respiratory the viruses, for example, like this SARS-CoV-2 and then the influenza viruses, it would be best for that impacted person just remain at home. And then, for example, like in U.S., just official just guideline is just remain. It's not just mandatory, but I think it's just sort of just recommended to be isolated, just like a 5 days isolation. And then after 5 day isolation, then further just more of 5 days are just a cautionary just phase, and then they can just go to work and then others, but then they are actually advised to just wear masks. And then that's actually based on the transmission of this SARS-CoV-2. And then after 5 days, there are still just the viruses still have some chances to be transmitted, but then chances are lower. So now we are just lowering just the bars. Now you can just go outside, can work, but wear just a mask to protect other people.
And Dr. Chin-Hong, we also want to get your advice on quarantine. There's quite a bit of confusion about isolation measures for people with COVID-19 here in Korea, with many unsure whether they can continue their daily routines after contracting the virus. Health authorities said that since COVID-19 has been downgraded to a level 4 infectious disease, like Dr. Kim said, similar to the flu, patients can carry on with their routines, but recommended people to wear masks. Would this be enough? What's your advice?
So I think comparing it to the flu sometimes confuses people because they may not wear a mask after the initial diagnosis. So in the United States, as Dr. Kim mentioned, there's been a liberalization of isolation. So you only are isolating now for at least 24 hours. If you have no fevers, if you're feeling better, you can go out in the world. But it's confusing to people, but you need to keep that mask on for at least 5 days. If you're working in healthcare or in a nursing home or in other congregate settings, that rule may be stricter, like in the hospital where I work. And if you're living with people who are immune compromised, you may need to keep the mask on longer for at least 10 days. But 5 days at the minimum for the mask. Can leave the home after 24 hours, but you really need to exercise responsibility and wear that mask for longer. I think it's coming up right now with the reopening of schools in the United States, because previously there were much stricter rules for when children can go back to school. Now the onus is on the child to continue to protect other children and staff by continuing to wear that mask if they were positive at home.
So as we've learned through the past 4 years, wearing a mask, and at least for 5 days, according to your advice, would be crucial in preventing further spread of the virus. Thank you so much, Dr. Chin Hong, for sharing your insights.
Thanks so much.
And thank you, Dr. Kim, for coming in and sharing your perspectives.
Thank you.
And that brings us to the end of this show. Thank you for watching, and be sure to tune in same time tomorrow to join our conversation. Goodbye for now.